You would be amazed how often pregnancy is discussed in the rooms here at Caring Medical, just because a lot of women are either delaying pregnancy or trying to get pregnant because they got pain, like they don't want to get pregnant while they have a lot of pain, or will get a call and they got pain while pregnant and they wonder if they can get prolotherapy. So I can definitively say that you can absolutely get prolotherapy while you're pregnant. So we've been treating pregnant gals with prolotherapy for 20 years here at Caring Medical. So sure, we may modify the solution a little bit to make sure it's definitely hypoallergenic and it's very, very safe for the baby. The one thing though, we typically, if a woman was pregnant, we wouldn't give them IV Demerol. We would try to have them do the prolotherapy natural, though they could take Tylenol, prior to the procedure. But all the solutions we use with when a person's pregnant, that we use for the prolotherapy is very, very safe for the baby and the mother. And we always tell the mothers that we're learning more and more in medicine that the baby actually knows what's going on with the mother. So in other words, like the baby knows if the mother's in pain, and the baby also knows that the mother needs some kind of treatment. And I think that eases a lot of the anxiety that mothers might have. Because think about it, would your baby want you in pain or out of pain? And would the baby, is it going to be better for the baby if for 8 months you suffer from agonizing back pain while you're pregnant? I mean, that's not going to be good for the baby. It's going to be better for the mother to get out of pain, whether the mother uses chiropractic, whether they use massage, whether they use prolotherapy. So the mothers that, or the pregnant mothers that we see, is typically someone who we've seen already. They know prolotherapy works for them. Chiropractic didn't work, acupuncture didn't work, massage didn't work, so they want to get prolotherapy. So I just assure them that prolotherapy is safe to use while the mother's pregnant. The most common overwhelming pain that we see with pregnant women is a back pain, because as the uterus gets bigger and bigger and bigger, it puts pressure on the lower back and it puts pressure on the pelvis. So I would say pelvic injuries and low back injuries are the most common things that we see. But realize, as a woman's pregnant, her body does release hormones that kind of relax the ligaments. So you are more prone while you're pregnant to have a ligament injury. So if a mother has a pain that doesn't go away while pregnant, most likely it's going to be a ligament injury. And the treatment for ligament injuries, in my opinion, is prolotherapy. So I would just tell potential mothers out there that don't fret. You can always get prolotherapy while you're pregnant.